Clinton in Minneapolis is up next. Hey, Clinton, thanks for the phone call. You are live.
Hey, how you doing today, Dr. Glidden?
Fantastic, Clinton. What's shaking?
The question that I have is first about rheumatoid arthritis, and the second is for vertigo.
Well, same thing. It's two arms of the same octopus, right? So rheumatoid arthritis, of course, is a facultative breakdown. The body has run out of the stuff that it needs to maintain healthy bones and joints. It's just run out of bone and joint nutrients. And with a rheumatoid arthritic condition, in addition to that, like somebody needed something in addition to that, there's a little microorganism, we believe, that's living in the joint capsule. It's called a Mycoplasma. And when you get this little bug living in the joint on top of an under-nutrified joint, well, that's a big bad voodoo daddy. And so from our point of view, the only operative distance or difference between normal arthritis and rheumatoid arthritis is the presence of the bug in the joint of the rheumatoid arthritic patient. So when we're up against rheumatoid arthritis, what do? Well, we support and promote the structure and function of the bones. And the other thing was, in addition to rheumatoid arthritis, was it high blood pressure? What was the second thing?
No, it's
vertigo. Vertigo. Yeah, I did a great webinar on that. It's one of my favorite webinars, one of the favorite webinars I've ever done. It's called Tinnitus, or ringing in the ears. And interestingly enough, from our point of view, ringing in the ears, vertigo, Bell's palsy, lazy eye, chronic laryngitis, these are all caused by the same thing. It's osteoporosis of the skull. And if you're an insider on my website, you watch that webinar that I did called Tinnitus, or ringing in the ear, your head will explode, because that's what's going on here. Is the skull bone, we believe, has lost its structural integrity. And there's a little nerve that comes out of the brain and it goes to the eardrum. And in order to get to the eardrum, it has to go through a hole in the skull, a little tunnel in the skull. But when the skull isn't healthy, that little tunnel starts to collapse and it presses on the nerve. And if it's the nerve that goes to the eardrum, you get ringing in the ears. If it's the nerve that goes to the inner ear, you get vertigo. If it's the nerve that goes to the eye, you get a lazy eye. If it's the nerve that goes to the muscles in the face, you get Bell's palsy or tic douloureux, and so forth and so on. So it's osteoporosis of the skull, we believe, which is the same thing really as arthritis. It's just a lack of bone and joint nutrients, on top of decades of eating food that's not good for your bones and joints, right, which everybody does. So it's kind of like the 1-2 punch here, except the punch is coming at us instead of going away from us. We eat the wrong food all the time, so the bones and joints get weak, and then the body doesn't have the stuff it needs to fix them. It's only a matter of time until that's going to break, and that's what's happened here. So give bone and joint support, eliminate the 10 bad foods, keep your fingers crossed, see what happens.